Don't miss these 10 early cancer signs. It could save your life. Each year, millions of lives are lost to cancer, but early detection could have saved countless of them. Unfortunately, many early warning signs are easy to miss, and time becomes the critical factor. Imagine someone you love or even yourself ignoring a small, seemingly harmless symptom that turns out to be a silent alarm. What if that one symptom was the difference between catching cancer early and fighting it in its later, deadliest stages? Knowing what to look for could save a life. Today, we're diving deep into 10 early signs of cancer. These aren't vague symptoms. They're detailed and often overlooked signals that your body may be sending. Understanding them in detail could save you or someone you love from a late-stage diagnosis. 1. Persistent cough or hoarseness. Description: a cough that lasts for weeks or months, especially if it worsens over time, could be more than a seasonal illness. Chronic coughing may be a sign of lung cancer, especially in smokers, while persistent hoarseness can indicate cancers of the throat, larynx, or thyroid. This kind of hoarseness happens when a tumor irritates the vocal cords or presses on nearby nerves. Example: patients with lung cancer often describe a cough that feels different, deeper, more persistent, and often accompanied by symptoms like wheezing or a hoarse, raspy voice. When throat cancer is involved, hoarseness can start subtly but worsens over time as the tumor grows. Recommended action: if your cough doesn't improve after 3 weeks or becomes increasingly severe, seek medical attention. Coughing up blood, persistent chest pain, or difficulty breathing are urgent red flags. Tests such as a chest X-ray, CT scan, or laryngoscopy can help diagnose the issue early. 2. Unexplained weight loss. Description: while gradual weight fluctuations are normal, losing weight rapidly without changes to your diet or activity level is not. This type of weight loss often occurs when the body is fighting an illness, like cancer, or when tumors produce substances that alter how your body uses energy. Digestive cancers, such as those of the stomach or pancreas, can make it harder for your body to process nutrients. Example: in cases of pancreatic cancer, weight loss is often paired with symptoms like persistent nausea, upper abdominal pain, and changes in stool color or consistency. Esophageal cancer patients may lose weight due to difficulty swallowing or a constant feeling of fullness. Recommended action: if you lose more than 5 to 10% of your body weight within 6 months without trying, consult your doctor. A physical exam, blood work, imaging, or an endoscopy may be necessary to identify the underlying cause. 3. Skin changes. Description: your skin can serve as an early warning system for cancers both external and internal. Moles that change in size, shape, or texture may indicate melanoma. But did you know that cancers in other parts of the body, such as liver or pancreas, can also cause visible skin changes like jaundice, yellowing of the skin, or excessive itching? Example: melanomas can appear anywhere, even in areas not exposed to the sun, such as the soles of the feet or under the nails. Meanwhile, pancreatic cancer often causes the skin and eyes to turn yellow, accompanied by darkened urine and pale stools. Recommended action: perform a full-body skin check monthly, including hidden areas like the scalp, back, and under nails. Use the ABCD rule: asymmetry, border, color, diameter, evolution. Any suspicious changes should be reviewed by a dermatologist immediately. 4. Persistent fatigue. Description: fatigue related to cancer is more than just feeling tired. It's a bone-deep exhaustion that doesn't improve with sleep or rest. This can be caused by cancer itself, which diverts the body's energy to fight tumors, or by conditions like anemia, a common side effect of blood cancers or digestive tract tumors. Example: patients with leukemia often describe a fatigue so overwhelming that it makes everyday tasks like climbing stairs or cooking a meal feel insurmountable. In colon cancer, slow, undetected bleeding in the stool can lead to anemia, leaving you constantly drained. Recommended action: if fatigue lasts more than a few weeks and interferes with daily life, consult a doctor. Blood tests can detect anemia, while imaging tests can help identify underlying cancers. 5. Persistent pain. Description: pain that lasts longer than expected and doesn't respond to usual treatments is your body's way of signaling that something deeper may be wrong. Bone cancer often causes deep, sharp pain, especially at night, while tumors pressing on organs or nerves can create localized or referred pain. Example: advanced cancers in the abdomen, like pancreatic cancer, can cause back pain due to tumor pressure on surrounding tissues. Similarly, ovarian cancer can cause dull, persistent pelvic pain that women often mistake for menstrual cramps. Recommended action: if pain persists for weeks or worsens over time, don't ignore it. Imaging scans, such as MRIs or ultrasounds, may be needed to uncover the cause. 6. Changes in bowel or bladder habits. Description: any change in bathroom habits that lasts more than a few weeks should be investigated. This includes chronic constipation, diarrhea, or a feeling of incomplete evacuation, which are common signs of colorectal cancer. Blood in the urine or stool is another major warning sign of cancers affecting the bladder, kidneys, or colon. Example: colorectal cancer can narrow the intestines, causing pencil-thin stools or bowel blockages. Bladder cancer may cause blood in the urine, which can appear bright red or sometimes as a subtle pink tint. Recommended action: don't dismiss prolonged changes in your bowel or bladder habits. Colonoscopies, urine tests, or ultrasounds can help detect abnormalities early. 7. Difficulty swallowing. Description: trouble swallowing, also known as dysphagia, can begin as mild discomfort but progressively worsen. It often indicates cancers of the esophagus, throat, or stomach. Tumors can obstruct the passage of food, leading to choking, regurgitation, or even weight loss due to reduced food intake. Example: patients with esophageal cancer may describe a sensation of food sticking in the throat. Advanced cases can also result in persistent chest pain or acid reflux-like symptoms. Recommended action: if swallowing becomes painful or progressively difficult, see a gastroenterologist. Tests like a barium swallow or endoscopy can reveal obstructions or tumors. 8. Unusual bleeding. Description: unexplained bleeding is a significant red flag. Blood in the stool may suggest colorectal cancer, while blood in urine could signal bladder or kidney cancer. Vaginal bleeding outside of normal cycles could be linked to cervical or uterine cancer. Bleeding gums or excessive bruising might indicate blood cancers like leukemia. Example: in colorectal cancer, bleeding often mixes with stool, creating a dark or tarry appearance. In uterine cancer, patients often report spotting after menopause, a symptom that should never be ignored. Recommended action: any unexplained bleeding warrants immediate medical evaluation. Tests like colonoscopies, pap smears, or imaging scans can identify the underlying issue. 9. Lump or thickening. Description: a lump or thickened area in soft tissue, such as the breast, neck, armpits, or testicles, could indicate cancer. These lumps are often firm, painless, and grow over time. Swelling in the lymph nodes may signal lymphoma or metastatic cancer. Example: breast cancer lumps are usually immovable and feel different from surrounding tissue. Testicular cancer, meanwhile, may present as a small, painless lump that slowly grows larger. Recommended action: regular self-exams are essential. If you discover a lump, consult your doctor for imaging tests like mammograms, ultrasounds, or biopsies. 10. Soaking night sweats. Description: intense night sweats that soak through clothes and bedding, unrelated to fever, stress, or menopause, can be a symptom of cancers like lymphoma or leukemia. These sweats are thought to result from the body's immune response or the release of inflammatory proteins. Example: many lymphoma patients report waking up drenched in sweat, often accompanied by chills, fever, or unexplained weight loss. This symptom often signals systemic inflammation caused by the disease. Recommended action: If night sweats persist for weeks and are accompanied by other symptoms like fatigue, weight loss, or swollen lymph nodes, seek medical advice. Blood tests or lymph node biopsies may help confirm a diagnosis. Conclusion: these 10 warning signs may seem minor, but they could signal something serious. Ignoring them allows cancer to progress, but catching it early dramatically increases survival rates. Now that you know the signs, don't hesitate. Share this life-saving information with your loved ones. Like this post. Follow us for more vital health updates. And most importantly, listen to your body. Awareness today could save lives tomorrow. This is Dr. Health. Andy, see you soon.